Well, good afternoon. I'm here to talk to you about medical imaging. And as you can see, we started this program at Virginia Western some years ago, actually 43. I was very privileged to be in that first class. But it was a model program in the state of Virginia. Originally, if you wanted to be a radiographer, then you went to a hospital-based program, and it was 2 to 3 years. And we had hospital-based programs here in the Valley. We had one at Roanoke Memorial. We had one at Community Hospital at that time, was standing alone. And then we had one at Lois Gale. And there was a need in the profession to go from a hospital-based aspect of education to a more college-based education. So the powers got all together and were talking, and that's how Virginia Western came into the picture. And when that occurred, the two schools decided that they would close their hospital programs in form of beginning the 2-year associate degree, because technologists needed more education at that point, and the degree was coming into popularity across the United States. And then Roanoke Memorial, though, kept theirs for a few years after that. So the class began in 1972. As you could see, it's 6 semesters in length, so that's really 2 full years. And it is still going very strong. It was the very first program in the state of Virginia. It was considered a model, and now we have 5 programs, and Virginia Western is still considered an outstanding model. You want to know what radiography students take? Here's a list of some of the classes and some of the material that they have to know. It's pretty extensive, as you can see. Not only do they have to take the core curricula for general ed classes, as do all 2-year associate degree students, they also have to specialize in the field of radiographic technology and courses. So you can see the A&P classes, med term is important, and then all of the things that have to do with radiation and making an image of someone. So you have all of the protection aspects, the disease process of pathology, of course patient care, and then all of the image quality, production, and radiation exposures and radiation physics. So you can see that it's pretty intensive. Also, it correlates to clinical at the same time. So they have classes in clinical throughout the 6 semesters. We have our program accredited with the Joint Review Commission on Education and Radiologic Technology. And that is a programmatic accreditation, very similar to our college accreditation for SACS that we're all familiar with. Well, programs can have programmatic accreditation, and our programs in the radiological sciences here at Western have that. And that means that there is a standard to which these programs must contain material, stays current about the field, it dictates numbers and ratios, and it's a very intensive process, but it's also very substantial to know that your program is really outstanding. So what do radiography students work with? This is an example. Some of these pictures are pictures of equipment that our students actually learn to work. And if you can see, this is a portable machine that goes to various parts of the hospital when patients can't come to us. This is a C-arm. This is a tube and a receptor unit located on a pivoting C-arm. It's used primarily in surgery. This is the same concept. Patient will lie still, and then we can pivot around them and do various types of filming. This is more an interventional suite in a hospital, and of course this is more the traditional look of the table and the tube. This is basically what we have in our laboratory on the 2nd floor of Fralin. So this is just some of the type of equipment that our students are learning to see and use in the 2 years of radiography. So the correct title for us is radiologic technologist or radiographers. Technician is no longer a usable term. That term went out in the 60s when we moved from hospital-based to college-based education. You can get degrees as far as a 2-year, or you can go all the way up to the doctoral level in radiation sciences. We are certified by a national organization, the American Registry of Radiologic Technologists, and many states have individual licensure. Virginia is one of those states. So our designations, you're all familiar with healthcare professionals and their name tags that they wear. Our name tags dictate that we are RTs. We're registered technologists in whatever discipline then we're choosing to study or certify in. Mine is in radiography, but you can go into many different areas, as I'll show you in a moment, and those initials follow your name. So I've included how my professional name looks in the world of radiography. Your name, a degree that you have, and then registered technologist in radiography by the American Registry of Radiologic Technologists. That last distinction there is an honorary distinction that I have from the National Society. These are the areas to which a radiographer can move into should they wish. And radiography is the foundation or the building block. And once you have that knowledge, these doors open up to all of these other areas, and you might find that they intrigue you and you would like to learn about them and actually perform images and exams in them. And so there's quite a host of things that the students can tailor to their individual needs. So why did we do advanced modalities? Anything past radiography is considered a modality and it's advanced. Well, a lot of this came to the forefront with the Affordable Care Act. In that is a little caveat that says if a hospital or clinic wants federal reimbursement, then the person doing the actual imaging procedure must hold the credentials in that area. So it has been in the hospital setting, for example, if I wanted to learn how to do computerized tomography, or shortened to call CT, that I would cross-train. I would spend some time in there and they would teach me, and there might be one or two people that had a CT certification, but not all of us would. We would be learning. Well, the Affordable Care Act said that's really not what we're going to reimburse for. So now they want everybody to have the credentials. So that spurred us with our local advisory curriculum board and our general interest in healthcare in this area, that we looked at these modalities and tried to offer them because they're not really out there readily available to technologists wanting to get in those areas. So we looked specifically at CT, we looked at magnetic resonance or MR or MRI, and we looked at mammography. Now, we're very lucky here at Virginia Western. We have an advanced modality that we offer. It was a certificate-based program, and Dean Graham was the program head prior to assuming being dean of the school. And she took that program from a certificate to an associate degree. So we're very proud that we do offer that modality, but then we wanted to offer the others as well. And these basically take on certificates or classes. They do not have to be full-time degrees. This is an example of what CT looks like. The machine is a very large table that actually enters and exits through a large hole or a gantry. The computerization is highly evolved. They married an X-ray machine with a computer, and you get computer slices or cuts of anatomy of the body. So the student has to be very adept in radiation practices and also computer and cross-sectional anatomy. And you get images such as the bottom one here, very detailed as to the anatomy inside and recognizing what is abnormal versus normal. And you can also do things like 3D reconstruction, which this is an example of. Very good for internal structures, some bone work, not particularly great for the vascular system and a lot of the things to do with the spinal cord. So that is what CT looks like. It requires you to understand the properties of how to make an image that requires radiation and the heavy use of computers. And this program we've begun is 2 semesters, and you have to learn the foundations and patient care. You will have sicker, more critical patients coming into your suite of CT. So it's a little bit about what that looks like. The next thing is MRI, or magnetic resonance imaging, and that requires no radiation. That's a different medium to image the body with, and that is the use of magnetism and sound waves. The patient actually goes into a very large magnet, 1.5 Tesla, which is 30,000 times the gravitational pull of the Earth, up to 5 Tesla. 5 is more, you would find that more in a teaching research type of hospital, but here in the Valley, we're pretty much around 1.5 to 2 Tesla. And it is a different medium, so you have to learn all about the physics of magnetism and sound waves. But the machines look like this. People do get claustrophobic, so they've also made an open unit, but open is not as good resolution for some images, and it is only used in certain circumstances, but very beneficial to people who are claustrophobic. And sedation does have to occur usually in this. People who need to lay for a period of time, they need to be very quiet. So medicine, giving medicines, again, the marrying of a computer to the concepts of magnetism and resonance or sound waves. This is, again, a 2-semester certificate-based program. We have clinical with these programs as well as online. And basically you have to learn the properties and get the education, and then you have to scan so many subjects in a certain manner, and then you're allowed to sit for a certification exam. So you do have to touch patients and get proficient. And of course you know that that's a knee, and I have a few others here. This is magnetic, and there is no radiation involved in this. This is very much like just viewing the complete anatomy, such as, with a cadaver or maybe in a surgical suite. So you could see how a neurosurgeon or an orthopedic surgeon would love this modality. It is very complex and hard to learn. It takes 3 to 4 years to get proficient really in this. And it is also a very highly, it's got a high monetary value. So insurance kind of looks at it and makes sure it really need to have this exam. But it's crucial, and you can see we do a lot of knees for ACL tears and so forth. It shows the spinal cord excellently with the disc, and you can see there's a herniation right here. You image in different planes, so you have to know cross-sectional anatomy. And this is just amazing when you think that you can see the body like this and there is no radiation. So we started that program here, and it's going this year and doing very well. The other thing we decided to do or looked at was mammography. The reason that we chose these is because this is what's being asked of us. They would like to have these in the area. And also, if you check the labor statistics, it says that imaging personnel will increase by 28%. So there is a need for this. Mammography, we scan all women and some men, more women than men, but men can get breast cancer. This is an online program. We will do this 1 semester in the summer, and then they will have to get so many examinations, and they will, our clinical affiliate of Lewis Gale is taking this on for us and helping the student get this information and this education. But this is what the machines look like. It is digital imaging, and to give you an example, this is a standard X-ray film screen. This is what digital looks like. Can you see the subtleties? Digital imaging is what people want, and that's what we're doing now with the entire human body. And this is example of localization spot on a mammogram. So this is the imaging. We're teaching what this is, how to do it, what it means, and to understand the positioning. And it takes time. There is a need for these people, especially in the rural area. You will find trucks that will go out and go to people who maybe cannot come into the larger cities. So it is, and women are screened yearly for the most part, the older population. So it is indeed a sought-after area, and we're glad that we can offer it here. But this is just a couple of classes. The other ones are certificates, but this one's really just a class. You must be an RT to go on to those 3 areas. You just can't walk in and have no background and walk into those areas. Some of the other areas that Dean Graham and I are looking into that we would like to bring to this area is sonography. Of course, you are really close to the patient. This is no radiation. This is directed high-pitched sound waves, various forms of transducers and so forth. Again, very heavy in the computerization. Of course, you always think of the baby, and do the fetal reproduction, but you can see blood flow, Doppler in real time. And we use it for organs. We can see whether something is fluid-filled or solid. We can see gallstones, and I just think that's a funny film, so I put that in there. It's one I use in my class and try to get a chuckle. But we can detect stones or fluid-filled. But this is highly sought after. It can be an associate degree or a BS degree, and we are talking to Bluefield State. They will transfer our students in. But we have 2 programs in the community college system that offer sonography, and that's at Tidewater and at Piedmont. So our students do have an avenue, but this is a 2-year degree, and it is, again, very popular, and we hope to bring that a little bit more into line with Roanoke if we can. Interventional, or it used to be called special procedures, but it's interventional, looking at the vascularity, whether it's arteries or veins. This is highly sought after. There is a wonderful program at Forsyth Technical that we hope to have a liaison with them and bring it online and then let the students have clinical here in our area. But this is a heart catheterization. This is a blocked artery that they've opened up. They do biopsies, as you can see here, trying to get into a certain mass, looking for aneurysms, any sort of clots, anywhere in the body. So it is like a mini operation. You're surgically attired in the rooms. The equipment is very large. Again, very technical, but we hope to bring that here as well. There is a need. Cardiac and vascular in this area. The other one is nuclear medicine. This one we will not bring to this area. It is the most expensive one, but we will develop liaisons, and we already have. This is the only 4-year degree requirement in the field of diagnostic medical imaging. Due to the radiopharmaceutical aspect, the legality, this one takes 4 years. And the equipment, you become the source of the radiation. You're injected with radiopharmaceuticals. You give off radiation, and that radiation then is harnessed, and they can tell if there are indeed anything in the organs that might be impeding the flow of blood, a mass or whatever. We can do bone scans to see if there is any sort of situation in a bone. Lots of times if you're diagnosed with cancer, they will scan your body and see, is it somewhere else? Did it start somebody? Where? Is it primary, secondary? Great need for this. And this right here is cardiac. They do a tremendous cardiac scanning of the heart, stress tests, and then they put the contrast in, and it shows if you've had a heart attack, what does the heart muscle look like? Has part of it been affected or not? Very critical area of imaging, and right now Bluefield State offers that, ODU offers it, and VCU and MCV up in Richmond offer it. And we have had students transfer to specifically the VCU MCV program and have done quite well. We have a 100% transfer rate when they apply. So the other thing that a student can do is to get BS degrees, and we have articulations in place for that. And it depends on what the student wants to do with that. They want to run a department, they could do business, even get a master's in that. Couple that with your imaging, and then you would be somebody in management in a department or clinic. They want to teach, they can pursue some educational degrees and classes. You can get a full BS, master's or doctorate in radiation sciences, learn more about your field. You can do health management and run hospitals, clinics, things like that. And then you might just do the one like I just mentioned at VCU MCV to get a BS and then get another modality. So there are many avenues in medical imaging that students can do, and by offering CT, MR, and mammography here, we're trying to open that up for students who didn't have a chance to quit their job, go get education. Now they're online and they can work, get these additional modality certifications, and be a contributing member here in the Roanoke Valley, which has a very large population of healthcare. Thank you very much, and I appreciate your attention.